Birds are beautiful companions. Their gentle sounds bring peace to the home. Their presence reduces loneliness and provides emotional comfort, especially for people over the age of 50. Many people consider their birds part of their family. They care for them daily, talk to them, and feel happiness from their presence. There is an important scientific reality that most people are not aware of. Birds can carry microscopic organisms such as bacteria, fungi, and allergens. These organisms are invisible to the eye, but they can enter the human body through the air we breathe. For people over the age of 50, the immune system becomes naturally weaker, and the lungs become more sensitive. This makes older adults more vulnerable to infections and respiratory diseases caused by birds. Information is not meant to create fear. It is meant to create awareness. When you understand the risks, you can take proper precautions and continue enjoying your birds safely. Let's understand the health risks associated with 10 common birds, one by one. 1. Pigeons. Pigeons are very commonly kept in homes and on rooftops. Their droppings can contain a fungus called Cryptococcus. When pigeon droppings dry, they turn into dust. This dust can mix with the air and enter the lungs during breathing. This can cause a disease called cryptococcosis. This disease mainly affects the lungs and sometimes the brain. Symptoms may include cough, chest pain, fever, and fatigue. Older adults are at higher risk because their immune defenses are not as strong as younger individuals. Droppings can also contain another fungus that causes histoplasmosis. This infection causes lung inflammation and can feel similar to pneumonia. Recovery can be slow and difficult for people over 50. 2. Parrots. Parrots are intelligent and emotionally engaging birds. They form strong bonds with their owners. However, parrots can carry bacteria called Chlamydia psittaci. This bacteria causes a disease known as psittacosis. Psittacosis spreads through feather dust, droppings, and respiratory secretions. When these particles enter the air, they can be inhaled into the lungs. These include fever, headache, muscle pain, dry cough, and pneumonia. In older adults, psittacosis can become severe because the immune system responds more slowly. In rare cases, it can also affect the heart and cause inflammation. 3. Chicken. Many people keep chickens for fresh eggs. Chickens often carry Salmonella bacteria even when they appear healthy. Salmonella spreads through contact with chickens, their droppings, eggs, or contaminated surfaces. When Salmonella enters the human body, it can cause diarrhea, fever, dehydration, and weakness. Over 50, dehydration is particularly dangerous. It can lead to serious complications and may require hospitalization. The body takes longer to recover at older ages. 4. Duck. Ducks can carry harmful bacteria, viruses, and parasites. One important risk is avian influenza, also known as bird flu. Although human infection is not common, it is possible under certain conditions. Droppings also release bacteria into the environment. These bacteria can irritate the lungs and worsen existing respiratory conditions such as asthma or chronic bronchitis. Adults are more vulnerable because lung function naturally declines with age. 5. Turkey. Turkeys can carry bacteria such as Salmonella and Campylobacter. Campylobacter infection can cause severe diarrhea, abdominal pain, and weakness. For adults, this infection can sometimes spread into the bloodstream and cause serious illness. Turkeys also release feather dust into the air, which can irritate the lungs. Long-term exposure may lead to a condition called hypersensitivity pneumonitis, also known as bird fancier's lung. This condition causes inflammation in the lungs and makes breathing more difficult. 6. Canary. Canaries are Number 7. Finch. Finches are easy to care for and commonly kept indoors. Like canaries, finches produce feather dust that can enter the lungs. Long-term exposure may cause chronic inflammation. Over time, this inflammation can lead to permanent lung damage called fibrosis. This makes breathing more difficult and reduces oxygen supply to the body. This can cause fatigue and weakness, especially in older adults. 8. Lovebird. Lovebirds are affectionate birds and often live close to their owners. They can also carry the bacteria that causes psittacosis. Lovebirds stay indoors and close to humans. The risk of inhaling contaminated particles increases. Adults may experience fever, cough, weakness, and pneumonia if infected. 9. Cockatiel. Cockatiels produce fine powder from their feathers. This powder spreads easily into the air and can be inhaled. Feather powder can irritate the lungs and worsen respiratory conditions such as asthma or chronic obstructive pulmonary disease. Over 50 are more sensitive because lung elasticity decreases naturally with age. 10. Peacock. Peacocks are large birds often kept outdoors. Their droppings can contain bacteria, parasites, and fungi. Peacock waste can release harmful particles into the air. These particles can enter the lungs and cause infection or allergic reactions. Adults with weaker immune systems are more vulnerable to these effects. It is important to understand why people over the age of 50 are more at risk. As the body ages, the immune system becomes less efficient at fighting infections. Lung capacity decreases, and the ability to clear harmful particles becomes weaker. Recovery from illness takes longer. Chronic conditions such as diabetes, heart disease, and lung disease increase vulnerability. These factors, even small exposures, can have greater effects on health. Also, warning signs that should never be ignored. These include persistent cough, breathing difficulty, fever, unusual fatigue, chest tightness, and weakness. If symptoms occur, medical consultation is important. There are simple and effective ways to reduce these risks. Clean bird cages using gloves and a mask. Wash hands thoroughly after handling birds or cages. Keep birds in well-ventilated areas. Avoid keeping birds in sleeping areas. Reduce exposure to feather dust. Ensure regular veterinary care for birds. Ventilation and hygiene significantly reduce health risks. In conclusion, birds bring emotional comfort, companionship, and joy, especially during later years of life. They improve mental well-being and reduce feelings of loneliness. Scientific evidence shows that birds can also carry microorganisms that affect human health, especially in older adults.